everybody is enjoying somewhat of the rain that has stopped. My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. We are going to talk about why your knee hurts when you walk. So when I'm shooting this video, it's springtime. Lots of activities are starting outside. We had a great Saturday last Saturday. Sunday was a little rainy, but starting to get out more, starting to kind of get out of our winter hibernation, which means we're walking more. We're doing a lot more. Plus, right now it's 2021. We just came off of quarantine for almost a year, so we moved 50% less last year than as compared to any other year our cell phones have tracked us. So there's a number of reasons right now why knees are starting to hurt. So first of all, is footwear. It is really important that if your knee is bothering you at all, you want to make sure that you're wearing the proper footwear, because you want to make sure that your foot is in proper alignment when it hits the ground. So the shoes I have on, which are flats, are not that great. You want to wear some type of supported walking or running shoe. It's really important because especially if you're starting to walk outside, you are going to have that uneven terrain, whether it's a sidewalk, whether it's a gravel path, whether it's grass, no matter what it is uneven, and it's difficult for your foot to be stable as it's moving across these different surfaces. So a supportive shoe will allow that to help. And that's one of the reasons why your knee does hurt, is because it takes a while for your body to adjust to being on different surfaces. Walking on flat surfaces or carpeted areas is much different than walking outside on a concrete path, something like that. So if you're noticing your knee starts to hurt when you're going from inside to outside, that's one of the reasons. You want to make sure you really pay attention to that footwear. So let's talk about just walking in general. Why does it start to hurt? So a lot of times your knee's going to start to hurt when there's a bunch of different things going on. And here's the difficult part about the knee is everything from the hip comes down and attaches at the knee. Everything from the foot and ankle come up and attach at the knee. So you have a lot of muscles and a lot of things going on. I always say the knee is the hub for a lot of activity. Nothing really happens at the knee that doesn't happen up here and down here. And so that's why it makes it so difficult. And most of the time that we're looking at knee pain and we're diagnosing knee pain, it's happening because of failures at the hip and failures at the foot. So if you're only addressing the knee, let's say you're just doing some knee exercises, something like this, you're not going to get any better, because you need to address what's going on here, maybe in your abdominals and at your feet. So when you start to look at that whole picture and you start to look at why does my knee hurt, that's the reason why. A lot of people will put on tape or a knee sleeve or some sort of like band that will help. Those are temporary fixes. I don't even call them fixes, because all they are just holding off the pain that's going to eventually get bad enough that you're not going to be able to sustain your walking even. So don't just kind of buy something over the counter that addresses that knee pain, or just put a little heat or a little icy hot on the knee. You have to pay attention to the hip and you have to pay attention to the foot. So the foot we talked about. The foot, you really want to pay attention to the footwear you're wearing. You don't want to go barefoot. Flip-flops are bad. These flats, high heels, you really want a supportive shoe. That can be one of the reasons that your knee is hurting. A lot of times what's happening though is there's a muscle imbalance. And that muscle imbalance is going to be made worse in a unsupported shoe or a flat shoe or a flip-flops or bare feet. And when I say muscle imbalance, it means that some muscles are stronger, some muscles are weaker, some have knots, some are looser. So it's really important that you kind of address this from all angles. A lot of times knee pain when you're walking is becoming from some type of maybe IT band pain. So you're going to have some, if you put your fingers into your IT band, which is this muscle that runs along here, you're going to have some issues there. You're going to have some tightness. It also could be some patella issues. If one of your muscles isn't pulling exactly correct, it can cause compression on the patella, and that will cause knee pain with walking. So again, there's a lot of different reasons. And then you start to go up steps, and some of that compression that you are noticing because you have knots in your muscles and some of your muscles are weak, that causes some extra pain as you start to go up the steps. So some of that weakness can come from what we call a weak glute medius. So your glute medius is back here in your butt. What happens is when you can't stabilize with that muscle or your glutes, you're going to start to track inward. And again, this is a gross exaggeration because I'm on camera and I want you to see what happens. Many of you will not walk like this, but if I was to slow the motion down and look at it, a lot of people start to cave in when they walk because of weakness, because of muscle imbalance. Sometimes it's even because of shoe wear. So this type of improper walking causes knee pain over time. It's not always just arthritis, and people are really quick to blame arthritis on that knee pain, when really a lot of times the arthritis, we all have it over the age 18, it's completely normal. You need to address more than that. And sometimes we wind up seeing people with failed surgeries because of the fact is they said it was arthritis, they addressed the arthritis, but they never addressed the muscle imbalances. And we need to talk about that, and we need to address that. So again, when you have knee pain with walking, you are going to have to address a lot of different issues going on, not just the knee. Don't just put anything on the knee. So one of the things you can do is start to strengthen that glute medius. So what you're going to do is you're going to do just side kicks out to the side, nice and easy, okay? You want to make sure that you are balanced on one leg and you're going out to the side. You're not coming in front, all right? You're going to go straight out to the side, maybe even a little bit back. All right, try and balance on the one leg. If you have to hold on, that's okay. Preferably you don't. You stand on the one leg and you just reach back. Now, if you're really good and you can do about 3 sets of 15 of those with no burning, no problem, no pain, you can actually put a band around your ankles and you can start doing this nice and easy, all right, where you're just going back slowly, all right? But that's going to start to address, first of all, if you don't hold on to anything, that's going to start to address balance, which is good. A lot of people lack balance, which is part of, can lead into knee pain. So if you're not able to stand here like this, 30 seconds, no issue, close your eyes, you have some balance issues. So that exercise that I just showed you is going to kind of kill 2 birds with 1 stone. It's going to address some issues with your balance, and it's also going to strengthen some of your stabilizing muscles that are going to help stabilize this leg as it walks. It's really important that you have kind of these stabilizers up here, your core, your hips, so that way when you walk, your knee is not wobbling. And again, a wobbling knee is not anything that you're going to feel. It's not anything that you're going to notice with your naked eye. But again, if I put you on camera and I slowed it down, we could see a lot of wobbling and a lot of moving. So we just addressed 2 exercises that you can do. We also have foam rolling exercises. If you refer to our YouTube channel, Total Performance Physical Therapy, we have a lot of leg exercises for foam rolling. Those are exercises you want to do, especially if you are experiencing knee pain. Now, a lot of people stop foam rolling and tell me it hurts. If that's the case, it means you need to do it even more. Stopping foam rolling because it hurts, it doesn't make any sense. It means that that is probably causing some of that pain. So you don't want to necessarily push through that pain if you haven't seen a medical professional. If it hurts you and you want to, you need to stop and you need to seek treatment for it. We offer free consultations. All you have to do is call our office at 215-997-9898. We'd be happy to get you in. But make sure you address why you're having that pain. Don't quit foam rolling and just go, it just hurts too bad, I'm not going to do it. That's a sign of something that's going to go really, really wrong down the road. So we addressed a bunch of points on why your knee hurts when it's walking. So many people want to go get an x-ray and MRI and just find out the answer. Many times that answer is arthritis, and arthritis has nothing to do with the pain. And a lot of people just kind of chalk it up and just think, I'm going to take Advil or whatever over-the-counter pill, and it doesn't really work. It doesn't solve anything. So know that when you're looking for the reason on why your knee hurts, when you walk, you have to look above, you got to look at your hip, and you got to look all the way down your entire leg. And if you're just doing something for your knee, like a sleeve, a brace, you're not going to help it. It's not going to fix anything, and eventually it's going to get worse, and it's going to get to the point where you cannot manage it at all. If you or someone you know is suffering from knee pain with a free consultation with a doctor's physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a